Okay. Hello, my name is Sinead Holmes and I am the Project Manager for the Southern Universities Network. So welcome to you all and thank you for joining us today. The SUN is part of the National Networks for Collaborative Outreach Scheme, which is dedicated to improving access to higher education. The CPD webinar programme that you are part of today, it forms part of the NNCOP offer to staff in schools and colleges to help support progression into higher education. Today's webinar will be delivered by Jennifer Malpass, a teaching fellow, and Dawn Walsh, principal lecturer, both at the University of Portsmouth. Jennifer and Dawn will take over for me in the next couple of minutes, and they will deliver a presentation that is about sort of 25 to 30 minutes long. You should be able to see a PowerPoint screen, and hopefully you should be able to also see a camera. So you should be able to see me right now. What will happen is Dawn and Jennifer will go for the presentation, and then at the end we will ask you to send in your questions. In fact, if you have any questions throughout, you can send them in, but we won't address them till right at the end. At the end of the session, we will also use 3 polls, and essentially we want to just get your immediate feedback straight away, just to basically improve the programme going forward. You should have a control panel on your screen. It depends on how you set things up, but it may be on the left or right hand side of the screen, and you will see a little tab that says questions. So if you just open that, that will give you the opportunity to ask any questions. The webinars are recorded. This is being recorded right now, and they will be hosted on the NNCO regional network. So you may be in the Southern Universities Network region, so it'll be on that website, or you may be coming from somewhere else, and it'll also be hosted on that website. So without further ado, I am just going to pass over to Jennifer and Dawn, but to do that, I'm just going to turn the screen off and the sound, and I'll be back with you in 2 seconds. Thank you.
Good afternoon, my name is Dawn Walsh. I'm Principal Lecturer at the University of Portsmouth in the Dental Academy, and as you can see I've been in dentistry for quite some time, straight from school in 1977, qualified as a dental nurse in 1990, and from then until now I've had a variety of roles within dentistry, from dental nursing, practice management, oral health education, and I've also worked in education. I began teaching in '93 and came to work at the University of Portsmouth when the Dental Academy opened in 2004, predominantly involved with the dental nursing and dental hygiene and therapy programmes here.
Good afternoon, my name is Jennifer Malpass and I'm a teaching fellow here at the University of Portsmouth Dental Academy. I have been a dental nurse since 1998. I qualified in 2001. I've worked in dental practice, I've worked in the dental hospital and community dental service environments. I have some postgraduate dental nursing qualifications in oral health education, dental sedation, dental radiography, and I've been teaching here at the Dental Academy since 2014.
So what we plan to do today, or the outcomes for the session, will be to help you to understand the role of the dental nurse, and we'll explain the educational pathways to registration with the General Dental Council, and help you to understand the entry requirements for each of the pathways, and identify the application process as well. And then we'll advise on the location of further information should anybody need any further advice in the future.
Okay, so dental nurses are a key member of the dental team. So that dental team includes dentists, hygienists, dental therapists and dental technicians, and together they all care for and treat patients in all sectors of dentistry. So it's a really varied role. So you do everything from assisting with patient care to maintaining equipment, which means that it's attractive to people who are interested in the sciences and technology subjects, as well as those that are interested in healthcare.
So when we talk about the role of the dental nurse, the term that we tend to use is their scope of practice, so the things that they're allowed to do within the realms of their professional registration with the General Dental Council. So when they register or when they qualify and they begin to work with the clinicians, they can actually work chairside to support the clinician. That might be the dentist, the hygienist, or the dental therapist, or even the clinical dental technician. They're predominantly involved in supporting the clinicians and supporting the patient as well. And one of the big responsibilities of their role is the health and safety aspect of dentistry, and they're responsible for the decontamination of instruments and also cross-infection control within the environment. So they ensure that all dental equipment, materials and dental surgery environment are maintained. As well as that, they might get involved in reception duties, and obviously record keeping plays a big part of that, and obviously administrative duties around the management and the care of the patient and the practice as well.
Okay, so there are some postgraduate qualifications which can extend the scope of practice of a dental nurse. So dental radiography would mean that a dental nurse has undergone further training to be able to take x-rays of a patient's mouth. Dental nurse and sedation is again undergoing further training and qualification to be able to assist with anxious and nervous patients that might need some kind of sedative to enable them to undergo dental treatment. They can do a certificate in oral health education, which can be in practice, so in surgery, patient oral hygiene instruction, or perhaps going out into the community. You can go into schools and nurseries and provide some oral health instruction to the children. Fluoride varnish application is another skill that we can undertake, as well as impression taking. So impressions are moulds of patients' teeth, and dental nurses can undertake qualifications to do that. They can also do orthodontic dental nursing, which is a specialist branch of dentistry. So some further experience and qualification there is usually really desirable.
So how do they actually go about registering as a dental nurse? Well, obviously they've got to undertake a programme of study to enable them to do that. And with dental nursing, we are talking about routes to higher education, but some dental nurse courses are within further education. So there's two routes open.
So we have in blue on the slide there, that's your further education route, so that's the college routes. So there's level 3 diplomas, they're city and guilds or cash facilitated, and it's usually a qualification gained as part of an apprenticeship. So you will complete a portfolio of clinical experience in your practice, and you'll participate in skills assessments in the workplace as well. The National Examination Board of Dental Nursing has a lot of formative work-based assessments, and you complete a record of clinical experience with the NEBDN. At the end of the course, there is a written examination and a practical assessment, and both of those elements have to be passed successfully in order to qualify to lead with registration with the Dental Council. So after qualification and after registration with the Dental Council, there are further things that you can do with those further education qualifications. So you might want to access higher education by going on some access courses. You can further your study by completing some A-levels, or with both of those you can undertake the NEBDN postgraduate dental nurse courses that I mentioned in the slide before.
If you're interested in entering higher education to study as a dental nurse, currently there are 3 courses in the UK that support this route. So we've got 2 universities that offer the certificate of higher education in dental nursing, and that's basically a 1-year course studying at level 4. So it's basically like doing the first year of a degree. And those courses lead to qualification and registration with the General Dental Council. And the other option in higher education at the moment is a foundation degree in dental nursing. Again, that's studied at level 4, but that's a 2-year programme. And then once completed, if dental nurses then want to progress on further within higher education, there are options to enter other dental courses such as hygiene or dental hygiene and therapy, dentistry, or you may step outside of dentistry and look to more general health options such as general nursing, social work, or so on. If healthcare's you want to step outside of healthcare, obviously other options might include teaching or business and management, obviously, and then you can come back into healthcare with those qualifications. The other option within higher education is for dental nurses to go on and do a foundation degree in advanced dental nursing. So all of the postgraduate qualifications that Jenny talked about earlier are actually sort of put together in a foundation degree programme that gives the extended scope of practice to qualified dental nurses, and that's done at a UK university. So once dental nurses have done their basic level of training, either via further education or higher education, level 3 or level 4, they can then apply to register with the General Dental Council, and then that gives them the right to use the title of dental nurse, and it enables them to practice in all sectors of dentistry within the UK. And at that point, their graduate salary expectations are somewhere in the region of £14,000 to £16,000 per year.
There we go. So when you're deciding which route to take, you're going to think about the further education or higher education route. So further education, it's a vocational opportunity. So you will probably have a job as a trainee dental nurse working in a dental practice, and you are at college, you are doing that qualification as well, but you can earn while you learn.
And at higher education level, university, it offers, as I've said, the more academic route to registration. So if you think that at some point in the future you'd like to progress further in your education, then that's probably the better route for you to take. Having said that, if you go the further education route, obviously it doesn't prevent you from progressing on in the future. And we have many nurses studying at university who've come from that route. And obviously, you know, we do encourage all dental nurses to progress through to higher education at some stage in their career. As I said earlier, it doesn't matter which route you come through. The General Dental Council looks at all of the dental nurse qualifications as equivalent in light of the opportunity to register as a dental nurse professional. So they accept all of the courses as equivalent. That provides them with that professional registration.
Okay, so the entry requirements for the two courses can be read on your screen there. We have higher education and further education. So where it says equivalent, it is always worth checking with the course provider which equivalent qualifications they will have as acceptable for their specific courses. And down at the bottom point on both of those sections there as well, DBS is a disclosing and barring service check. So it's just going to look for any previous criminal convictions that might indicate that it's not appropriate for someone to be working with vulnerable members of the public. And the occupational health clearances, they just want to make sure that your immunisations are up to date, and you may have to undergo further immunisations which are recommended for all healthcare professionals. The GDC asks non-English speakers, or if English isn't your first language, they ask that you have an IELTS score of 6.5 or above. The higher education institutes are going to ask for that too, and that's just to make sure that you can study in English at that level. But across both courses, so the higher education and further education, the GDC want to just make sure that people are going to be able to communicate with patients in practice.
So what do we look for in an applicant? Well, we want candidates who have an understanding of the profession that they wish to join. So we look to see whether you've made an effort to find out about the profession, so you know what a dental nurse does on an average working day. Do you understand what their scope of practice is? What are they allowed to do as part of their job? And also that you have what it takes to get through the course. So if that's the academic route, that you've obviously got the qualifications preceding the higher education course, so your GCSE and A-level results meet our entry requirements basically. If you're going down the vocational route, then you still need to have that commitment, determination and motivation to complete the course, because you're going to be working a full-time job and then have to meet the demands of the course in your own time. So you'll have lots of coursework, and obviously that takes quite a commitment to study in your own time on top of working full-time in a practice. We also look to see whether you've got the ability to work in a team, and quite often that can be demonstrated through previous employment or previous voluntary work, or it could be working as part of a team within school, or perhaps even part of a team doing a sport that you enjoy, something like that. It's very important that you have a caring attitude, and that comes through in your application. And also an awareness of the NHS in the UK, so the NHS Constitution, and also the NHS core values. So the NHS look to applicants to make sure that they've got those values that all healthcare workers should have. And what we also would like is that you've got a bit of an insight into what's going on in dentistry in the UK, so what's in the news, what's topical at the moment about the profession that you want to enter, or about dental healthcare in general in the UK. The application process, obviously with higher education courses, they would come through the UCAS route. So that's for the Certificate of Higher Education or for the foundation degree. And for further education, quite often they're direct entry, so you would be applying to the educational institution or course provider directly. However, a lot of those course providers offer apprenticeships which are employer-led. So the employers themselves would be advertising for a trainee dental nurse, and then once they've got that employee in position, they would then offer them the training, and that's generally through a local course provider or a college in their local area. So in that case, you wouldn't have the choice of where you went to study. It would be done and led by the employer.
Okay, so this slide does have personal statement at the top, but as Dawn said, if you go the further education route, you might be employed as a trainee dental nurse, so you might have an interview to go to or a CV to fill out. So some of the points here is really pertinent for that too. But for university, if you check out the course that you want to apply for and tailor your statement, so you might want to attend that institution's open day, do some research, get online and investigate the courses to consider the qualities, the skills and the experience that that course provider is asking for. So think about why you're applying and just make sure that you're demonstrating some passion for the subject, for the profession and just for healthcare in general. We would like to see a sense of who you are in that personal statement and like why you want to do this as a career. So why do you want to be a dental nurse? And if you can demonstrate that you care, so we've mentioned before about the NHS core values, have a look at those, see what those are and see what you can pick out that can demonstrate that you care and the other values too. So let us know what your interests are and what you're interested in, but also let us know why you've chosen this course. It's really important, it is really beneficial if you can do some work experience or do some shadowing in dentistry or in other healthcare environments, as it sometimes allows you to demonstrate that you understand the job role and you know what you're getting into. A demonstration of a genuine interest in care and the treatment of patients is really important, and that you have an aptitude for the profession. and just what makes you stand out from other applicants. So why should you be considered for that course above others? And provide any details of any volunteering work that you've done, any charity work that you might have been part of, any clubs, groups or societies that you belong to. And as Dawn mentioned, teamwork and skills is really important in dental nursing, so make sure that you can write something about that. What have you done? What tasks have you been part of? How did that team complete something? And just really demonstrate that you have researched the profession and the dental healthcare profession just in the UK and what that means to you.
So career pathways for dental nurses are quite varied. So, you might choose to stay working in the clinical environment, and that's fine. So assistant clinician, whether that be the dentist, hygiene therapist, or clinical dental technician. You could go into specialist practice as well and work with an orthodontist or a maxillofacial surgeon in a hospital setting. There are a whole host of clinical options available. And as Jenny said earlier, the postgraduate qualifications that you can do can really enhance that clinical role and give you quite a bit of independence as a clinician. So it makes for a really varied and exciting career. If you want to step away from the clinical environment, there are, again, a whole host of varieties that the dental nurses can get involved with. So you can be a practice manager or a business manager, and with dental practices having to be compliant within CQC these days, there's lots of opportunities for business or practice management for dental nurses. You can stay within the practice environment but become more involved in patient administration or dental reception work. And quite a lot of dental nurses enjoy that side of the job and then sort of progress to more senior roles and get more heavily involved in the patient administration side of the practice. If you've got a passion for dentistry or dental nursing, then you could become an education provider, so work as a dental nurse tutor. Or you can work for a dental company as a sales representative or a sales product specialist. So again, stepping away from the clinical side of things, there are opportunities in industry as well for dental nurses, and that might involve research as well. Or you could go on to further study, as we've already discussed, and go back to university to study for a higher level course, for example, hygiene or therapy or dentistry. And then another sort of job that crosses over between the clinical and the administrative is the treatment coordinator, and that's a fairly new role within dentistry. It's been around for some time, but it's grown in popularity, and it's dental nurses who work more with the patients really to support their treatment planning options within the practice. So you would get more involved in patient education and sort of coaching patients through their patient journey through the practice.
Okay, so if you decide that dental nursing is definitely the career for you and you want a little bit more information, there are a few overarching sites that you have a link to here. So that's the General Dental Council, the UCAS Admission Services, the British Association of Dental Nurses and the Dental Nurse Network will give more pertinent information specifically for that dental nurse role, whereas the other two might be quite broad. And next you will see links to each of the universities who are offering the higher education option, as well as the NABDN and City and Guilds further education options. So thank you very much for listening to us this afternoon.
Thank you.
Back over to Sinead.
So thank you very much. So what we'd like to do now for everybody is just to ask you to answer a few poll questions, and I can see that we have actually had a couple of questions come in already. So we're going to come to those in a few seconds. But first of all, there's just a few polls. So I'm going to mute the screen, mute the sound, and they'll come up. Okay, thank you very much. All polls were complete. So a few questions then. Would you guys like to come and sit down?
Mhm.
So the first question is, what grade would be required for A-level biology for the HE route, and what equivalents are accepted? So they've also put a question mark over applied sciences.
Okay, so we generally accept A levels in pure science, so it would have to be biology, human biology, chemistry, or physics. Sometimes we have accepted applied science, but it depends on the science content within the course. But we certainly look at that. Equivalence could be an access course, but that would have to be an access course that was tailored to healthcare, so it would be a very science-based access course. Other things that we consider for dental nursing would be BTECs or NVQs, that type of thing, studied at level 3. So yes, a range of equivalents that we would accept.
And for your A-level biology, it would have to be a grade C or above to be accepted usually in higher education courses.
And so if someone's not sure about the equivalents, who is the best person to speak to if they have a course in mind, particularly university?
We have an admission, well, at this university we have an admissions team who you can ring or email for advice, and they have a list of equivalents that we accept that they can advise on. Or we have admissions tutors within the department that we can that they can put you in touch with. If they can't answer the question, then we will answer the question.
And is that likely to be a similar case at other providers?
I think so, yes. Most universities have admissions teams who deal with admissions queries, all year round.
There are so many accepted equivalent courses that unfortunately there can't be an overarching rule for everyone. It's got to be done with each individual institution.
And quite often for dental nursing, we look at each individual case on its own merits as well. So we can sort of waive the entry requirements to a certain extent. We would look for obviously a baseline level of educational background, but we can vary that in some cases dependent on the applicant.
Okay, so if you do have any more questions, we will be on the line for the next sort of 5 minutes. I will mute the sound, but if you do have any questions, please feel free to send them in using either the chat or the question section. But if not, feel free to log off, because otherwise we may be here for a while just waiting. Okay, so it looks like all questions have been answered. So thank you very much for listening.